I'm Paula Nutting, your musculoskeletal specialist, and today's video I want to acknowledge a great friend of mine, Perry Adams from Victoria. How many of your clients have tight scapulas that don't move very well and they complain of shoulder pain and or neck pain? I know I get quite a few that come into my clinic, and often the culprit is the subscapularis underneath the muscle, underneath the scapula, and also the serratus posterior. They flatten and or wing our scapulas, and you can see a very mild winging from my good friend Rosalind, who's helping me today. So the technique that we're going to use is a myofascial release technique where we're making the client move through range to try to get a stretch of the muscle and the overlying fascia. What you're going to get your client to do is bring the arms straight up to about 90 degrees and then bring the arms in whilst we pin the scapulas. Please use a towel because your fingers under their armpits is not a very comfortable position at all. So we're going to find the lateral border of the scapula, as you can see through here, and we're going to pin down and backwards. So I'm going to use it with the towel, but the angle is down and in bilaterally. So make sure they start with soft shoulders, and down and in I come, and I've pinned it. Now Ros, can you bring your arms up, forward, nice and slow. Encourage them to get them to about 90 degrees and then elbows straight. Lock them in. How are you feeling? Is that a slight stretch?
It's tight.
Tight. Okay, now bring the hands in together, elbows in together. Try to get them to touch. So we're pulling back and drawing, and I can feel one side feels slightly tighter than the other, and that's generally the area that they'll complain of the symptomatic picture side. So it might be shoulder or neck problems. I'm pulling in, gentle compressions. Okay, Rose, bring your arms down. Great. And we're going to apply that technique again. Arms up a little for me, just wide. Bring them down again. So now I'm higher, so I've come up higher. We're going to go low, middle, and as high as you can. And direct those scapulas protracted, so down and in. All right, Ros, up you come again for us. Feedback, a little tighter this time. Mm-hmm. Okay, and arms in together. In they come, in they come, in they come. Great work. Now Perry does a whole lot of fabulous neck and ranges, mobilizing. I'm not doing that technique, I'm just modifying it. And down you come. And we're going to apply it one more time. So you're going to go through that range 3 times. Sorry, Dale. In and down. Last time. Up you come. How's that feeling?
Yeah, it's tight.
Okay. Any pain? All right. Sometimes you will get pain. Pull them together. So be mindful because it's quite tender under that area. Anyway, you're going to apply that movement. So they're actively doing the myofascial work. It's not an indirect technique, it's a direct technique. And arms down for us. Use that in conjunction with many other moves, but you'll see that they'll quite often have a flatter scapula, less winging, and better shoulder range. I'm Paula Nutting, your musculoskeletal specialist. Hi, my name's Paula Nutting and I'm your musculoskeletal specialist, and today I've got my wonderful friend Lindy here who's helping me out today on our part 2 for carpal tunnel. Luckily for me, Lindy has got some signs of carpal tunnel, which are the 2 worst for most of the clients. Is that they have a lack of strength in contraction, but B, they have this annoying, aggravating pain that comes down into the hand and wrist, which is neural as well as muscular. So we're going to do a little test with Lindy. I'm going to get her to squeeze my fingers as hard as she can. Okay, and relax. And she really has got very little strength, and she's a personal trainer, so she should actually have quite a bit more than what she's giving us. I'm going to get Lindy to lie down for me, while I just give you a bit of feedback, what we're doing right now is we're going to try to work on Lindy's pecs and down the arm rather than only focusing on the wrist. So the pecs attach in a broad fashion, the sternum along the cartilage, clavicular line, and attach at the shoulder joint. And we're going to come in and pincer the pec and try to stretch that area to open up the shoulder capsule. So, here we go. I've warned Lindy that's a little bit uncomfortable. We're going to find that pec and we're going to elevate and lift up from it, and we're actually going to climb right underneath. Now Lindy's going to take the arm and I'm squeezing that muscle up into the ribs and she's doing a myofascial release. So she's actively moving that while I am pulling back. Pain level, Lindy?
It's about a 6 out of 10.
Okay, so we want to keep myofascial releases at a fairly, don't bash them. They're the ones that are doing through the work. But the advantage is that they're doing it, so you can blame them for the pain, not you. One more time.
That's feeling better already.
Okay, there you go. So we're getting 5 strips and she's already feeling a little bit nicer through there. I'm just going to turn. Now the next thing we're going to do is do some stripping through that bicep. So I've put a little bit of lubricant on my thumb earlier and she's going to relax the wrist. Some of those tips, people will sleep with their elbows closed in like little angels at night, and by using splints to keep the wrist open and having the arm elongated under the pillow will assist quite a lot with some of the nerve pain that they'll be getting first thing in the morning and the stuff that wakes them up in the middle of the night. How's that feeling now?
It's feeling much better actually. Looser.
Yeah, it was really nasty a second ago. I'm just going to grab a tiny bit more oil-based lotion. Try not to use something that's going to be too slippery. That needs to feed in. Now the last part of the move, before you even look at the wrist, is doing some myofascial work on the forearm flexors. So you can see Lindy is taking the wrist up into full extension and flexion, and I'm locking in at that muscle, the muscle structures, and as she's taking the wrist into extension, I'm gliding up towards the elbow. What have we got going on there?
Well, it's feeling better each time I do it, but it felt a bit tight to begin with, but it's getting better.
And every now and then you'll hear a clunk, which is what I just got then. Don't worry about clicks and clunks, it's only high velocity stuff that's an issue. And as you can see here, her arm is really well positioned. She's got a lot of support with the back of the table, and you can see now I'm applying a greater force down there. Yeah. At this stage I normally say suck it up, but you know, as long as we're under that 8 out of 10 kind of feeling. Secondarily, sometimes we forget about the interosseous membrane. Sorry, Lindy. We might be catching a little bit of the nerve structures in there, and I don't want to do that, so I'm going to start a little bit lower. And I'm going to get her to rotate the radius. And I'm just locking the radius so it can't rotate. Everything that we need to do for the wrist, we have to consider right from the neck down. And relax. And the last thing, the very last thing I do is I start looking at opening up that component where the median nerve comes through the wrist, through that reticular space. I can't fix carpal tunnel. I can, however, make steps to make Lindy feel stronger, and with a little bit more strength gives a bit more control, and a bit more control gives a little bit more ownership of how she can support herself through the process of relieving the carpal tunnel. How are you feeling?
Good. Yeah, really good.
Okay. Now, I'm going to get Lindy to sit up for me again. If you test in one position, always test in that same position. Okay, not too bad.
No,
okay.
great.
Can you squeeze again for me?
Oh, it feels much easier.
Yeah, and much
I feel
more.
like I've got a good grip.
Yeah, you do. From fairly weak to quite a moderately strong grip. Hope that's helped you with some of these tips, and we'll see you soon. Thanks. Hey guys, it's Paula Nutting, your musculoskeletal specialist, and today I've got one of my clients, Dante, who came in. I normally treat Dante about monthly.
Monthly.
Yeah. And he does a lot of work with his upper body. What's your job?
Furniture maker and a carpenter.
And a damn good one too, I've got to say. So he's just started doing gym, like weights in a new gym instead of home stuff.
Yep.
And came into me with what today?
Shoulder impingement on my left shoulder, so reaching up, certain press exercises, anything overhead, really sore, can't sort of handle anything heavier than a really light weight. So yeah, hoping to get a result from the massage, and after the session there, it's fantastic now.
Yeah. So about a couple of weeks, no, a week I suppose, of quite tight, nasty impingement. And what we wanted to try to do was to get some kind of really good biomechanical movement through the shoulder. We all know that tricky subscapularis quite often is a problem. And at first I did a pin and stretch, so just made him go through a shoulder range through there.
Yep.
And then, which worked pretty well.
Yeah, almost straight away, to be honest.
But we still didn't have quite good range through that extension, like the arm coming through. So then I tweaked it with a little bit of the thoracic work using the Chapman's reflectors or the neurolymphatic points, and the results were?
Excellent,
Yeah.
Now full range of movement, and it'll be interesting to see next week at the gym how much load I can take.
Yeah, so we'll do food feedback. I'll find out from Dante at the end of Monday after his session to see how the shoulder's pulled up.
Yep.
But ultimately, done a really good job. So
very happy.
Thanks so much for coming and being part of my guinea pigs.
No worries.
And we'll talk to you later. Paula Nutting, your musculoskeletal specialist, and I will fill you in later on with the courses coming up: Brisbane, Sydney, Toowoomba now, plus Burnie down in Tassie, and a few spots overseas next year. Cheers. Bye.